Dr. Maureen Mooney has a PhD in psychology, and she's been a consultant for the Red Cross and Save the Children. And she's also the author of the chapter of the World Disaster Report on Inner Resilience, and she will tell us a bit about this and also about present challenges for psychosocial support and also maybe future research needs. And yeah, up to you, Maureen.
Thank you, Camilla. Well, thank you very much for letting me present this. Let's take a quick look at the chapter and, as you say, the challenges. The World Disaster Report in 2016 is on resilience building, which is interesting. I think it shows this trend that you can see in the images on the slide. Top right from the Australian government, in the middle from Singularity University, so there are academics, there are government, and of course from the IFRC PS Centre, the training module. So the chapter that we're going to discuss right now is chapter 5, and it looks at mental health and psychosocial support interventions in building resilience within the disaster cycle, because this is the World Disaster Report. If we look at psychosocial resilience following disaster, but even if we think of this pre-event, you can read, hopefully, that it's broadly understood as a dynamic processes. So if we're working with these dynamic processes, we have to understand them. And I'd like to emphasize it's around individuals, but also communities exposed to potentially traumatic events. And of course, we know that these are culturally specific. If we look more closely at psychosocial support and promoting mental health and well-being, I've put on the slide quite a broad definition, but again we're looking at processes of facilitating resilience with individuals, families and communities, and of course by respecting their independence, dignity, coping mechanisms. This is an approach that has been community-based, and I think I'd like to look at what mental health and psychosocial is. When I wrote this chapter, it was a very quick deadline. I wanted to give an overview because I'm not quite sure of the audience, whether people know about it or not just the audience today in this webinar, but of the World Disaster Report. So I wanted to talk about the increasing consensus around mental health and psychosocial support. And this can be seen in the IASC guidelines, this one of the pyramid that most of you perhaps will be aware of, which is a multiple stepped approach. And it is something that has been discussed, this multi-layered approach. It is usually represented in a response situation, but we'll look more at all aspects of the disaster cycle in a moment. And it has been constructed to prevent mental disorder and treat it when appropriate, but specifically to promote and protect psychosocial well-being. At the moment, at present, mental health and psychosocial has evolved, I think, in the humanitarian setting. And this is evident in what has been happening, but also in the small amount of research we have around this area. There's a lot of dialogue between different structures, which is very positive. It's quite a complex phenomenon that's been developed, and it's ongoing. And what we've seen is that there are quality standards coming out, which is really important, I think. There are reviews of the guidelines of what's happening. There's a focus that's shifting to all aspects of the disaster cycle, and I will talk about other adversity events later. And it is about facilitating this resilience in individuals and multiple community spheres, but I think good practice is also increasingly about collaborating with local resources and knowledge and structures. We'll see if we actually manage to do this. I think then, just if we look at mental health and psychosocial interventions in the disaster cycle, I'd like to start with what I tried to cover with disaster preparation and mitigation. This is about promoting capacity building of populations. There are quite a few interventions starting now around this. A lot of them have to do with mapping of community strengths and vulnerabilities pre-event. UNICEF has done this with children, so has the Red Cross. Many structures have approached this. We're also looking at facilitating community networks pre-crisis, because we know that after event or events often, these networks are disrupted, perhaps relocated, and it's important to strengthen them pre-event. And we're working with populations. I think this is an interesting area on how they can prepare psychologically to hazards. The research community may want to look at whether this works or not. Does it work long term? And there's quite a bit of research around disaster preparedness that could feed into our sphere. But working with the population on how they can prepare psychologically to hazards is already being rolled out in some areas. I'd give you an example of the READY plan, of all hazard approach, of what's happening with people having to think about and prepare for what they think their reactions are going to be, and who would they go to discuss these reactions, and what coping would they use to deal with these reactions. There's also within the Red Cross movement, I don't know if you've heard of this, of the pillowcase project with children who, for a pillowcase when it's appropriate, talked through a program that they can think of what is really necessary in case something happens. Now, when this preparation and mitigation goes on, it can increase the sense of agency and efficacy in a population. It may increase investment in community mitigation and disaster preparation. It can foster, if we're really lucky, the development of policies for mental health and psychosocial support and contingency planning of country or regional or area disaster plans. So that's a very brief look at what we can do pre-event, and hopefully we can discuss this later in questions or comments. If we look at disaster response, there's a lot more that has been developed, obviously, because we've probably started in this spiral of disaster cycles with having to respond to events. So as said before, minimum standards, good practice guidelines exist. We're able to integrate in other programs such as food distribution, shelter, WhatsApp, restoring family links, child protection, etc. Psychosocial can be integrated within these. They can give an added layer. They can also be around preparation of those programs and response. Whether this happens in reality or not is another question. And as probably a lot of you know, these psychosocial activities can include psychological first aid, the lay counselling, promoting community rituals and activities, life skill training, advocacy, recreational and creative activities. And perhaps we can hear about some examples later on. And if we go to the disaster recovery with mental health and psychosocial, this is perhaps a little bit more problematic in my opinion from what I've seen of the literature and the practice. We know that mental and psychosocial distress are often ongoing long-term needs in situations where ongoing long-term needs are not often addressed. If we look at the Sendai Agreement in 33.0, there is a reference to enhancing recovery schemes to provide mental health and psychosocial interventions, and that gives us a structure, but even if this ratification can we say it's been put into practice? So sustainable disaster recovery programs appear to be, for the moment, limited in number. Now, we could discuss when humanitarian, psychosocial and mental health interventions become development programs, and that's an interesting area because I think this transition would show us some of the gaps, such as funding streams, for example. If we look then at present challenges of perhaps the humanitarian context at first, we see that the disaster and other humanitarian crises are becoming increasingly complex, it appears. There's an interaction between political, economic, social, and environmental systems going on. We see that some populations go from crises to vulnerability, back to crises, back to vulnerability. There seems to be an ongoing situation. We now see acute events layered onto chronic crisis situations. Perhaps this always happened. Perhaps we're more aware of this now. There is an actual situation of changing climate risks. If we want to just give examples of the extension of insect-borne diseases, of pollution by salt water into water situations, low-lying island nations are now perhaps being forced to relocate. So we're thinking of whole populations, whole cultures relocating. Where do they go? How do we support them? How do we support the people who perhaps are welcoming? Is there a welcome? I can go on and we could discuss this more. But if we come back to how mental health and psychosocial interventions can dovetail into this humanitarian context, we need to address these complex situations that may keep going. So if we look at challenges in the way we deliver mental health and psychosocial, I've listed a few here, but not all. So there does seem to be a gap between guideline recommendations and quality guidelines and practice in the field. I won't give examples at the moment, though I have given some examples in the chapter. It's always delicate, but if we're practicing in the field, we see this. There is not as much collaboration with local stakeholders as is necessary, and I think this is a real trend that's going on. I've just the last 2 days been in a humanitarian workshop where we know that a lot of funding, and perhaps from my personal point of view quite rightly, is going to go now from donors to local resources. And how are we in our mental health, psychosocial going to collaborate, learn from, and perhaps promote capacity in local resources? We have a lack of surge capacity of trained psychosocial workers in large-scale events and perhaps in ongoing chronic events like HIV, AIDS, perhaps long-going terrorist situations. And at the moment we're dealing in Europe at least with large, and in the Middle East with large relocation of populations and refugees. As I said before, there's a challenge to sustainability of psychosocial interventions. How do we allow them to be sustainable? How do we continue capacity building on a regional scale? There's a limited evidence-based research, and this goes back to this research group starting on actual psychosocial interventions and what mental health psychosocial in different cultural contexts may look like, so that we may need to tailor our interventions around, in fact I think we need to tailor our interventions around different cultural contexts within countries and regions. We need for a stronger assessment, monitoring and evaluation, and there's good news with the new kits coming out from the IFRC and the Mental Health Psychosocial Network. And I think that will give us a lever for research, and I'll come back to that. And I don't see in the examples that I had looked at how psychosocial is not fully integrated in humanitarian response approach. And that has something to do with us communicating, but it also has to do with the whole humanitarian world and how it operates. If we look at, just very briefly, some avenues for future research, we do need more evidence-based or practice evidence-based information around psychosocial interventions. And most people in the research area say that it's the lower two tiers of that pyramid where it's lacking. I think there's more and more. I think that has been heard. I imagine that that will increase. Where do we get our data? And that's where I think we can use, once monitoring and evaluation becomes more widespread, that will be picking up data that then perhaps we can use to start looking at these interventions. We need a larger evidence base of what well-being and mental health is in different cultural contexts before we can really build that resilience around those processes. And probably we need to look more at what is working in these areas as opposed to what is traumatic, because I think we need also to know processes that work. We need to have more understanding of community resilience elements. I think it is stronger what we know about supporting individuals and families than what we know about supporting the complex community systems. And certainly we need longitudinal studies to understand effects of mental health interventions over time, to see how this may evolve, how needs can evolve, and so our programs, but also, is this effective long term? And do we need to renew, for example, interventions around preparedness and mapping, because these change? So for me, I'm quite enthusiastic about this, obviously, and very interested in this area. It's my area, but I do see there's a lot going on, and I think it's for us to step up would be a really great thing. So thank you very much. I think now, if I understand correctly, if you haven't understood anything, please say, but I'll hand over to Camilla to explain it. Thank you.
Thank you very much.